I'm going to invite Dr. John BRITTON, who is Director of the UK Centre for Tobacco and Alcohol Studies. Dr. BRITTON, please.
Good afternoon, everybody. Thanks for the invitation to speak. I'm Professor of Epidemiology at the University of Nottingham, and I'm a consultant in respiratory medicine at Nottingham City Hospital, so I deal with the effects of smoking in clinical practice every day. In addition to the UK Centre, I also chair the Royal College of Physicians Tobacco Advisory Group, and through that role have been responsible for the production of 2 reports on tobacco harm reduction. One in 2007 called Harm Reduction in Nicotine Addiction, which maybe you can see here. And then last year, something called Nicotine Without Smoke, which focuses particularly on the role of electronic cigarettes. We all know that smoking kills people, ends lives prematurely, it causes untold damage to adults, and it harms children, harms the unborn child. And it drives poverty, and it is the major determinant of social inequalities in health. And so treating smoking is a huge public health priority in all developed countries. Conventionally, we've done very well in reducing the prevalence of smoking, but in Canada, in the UK, and in many other countries, through standard approaches to tobacco control, which have been things like advertising bans and the health warnings that Canada championed. Smoke-free policies and so on. And those have had their effects, there's no question about it. But if you look at the figures on smoking prevalence within age groups in the UK for sure, what is very clear is that those measures have been very effective in preventing children from becoming smokers, but they've been far less effective at helping established smokers to quit. And in fact, if you are a 25-year-old smoker today, the likelihood that you will quit smoking in your lifetime is probably far less than it was as a 25-year-old smoker 30 years ago. We need measures that help those established smokers to quit. And that's partly because it saves lives, but also because that pays off on our health services and our society now and next year and in the next 5 years, whereas preventing uptake of smoking pays off in 50 years. We have had a sort of sacred cow of smoking cessation, which is that smokers should learn to give up nicotine in order to give up tobacco. And the 2007 report from the RCP that I mentioned really made the argument that that necessarily isn't the case, that we could encourage smokers to switch to an alternative source of nicotine and just give up the smoke. The logic being that nicotine is about as hazardous as caffeine. It's the other toxins in cigarette smoke that kill. At the time that report came out, there were very few alternatives for smokers, but the proof of principle came from Sweden, where the use of oral tobacco has largely replaced smoking, so that Sweden has one of the lowest prevalence rates of any developed country. And it's as a consequence of smokers shifting onto smokeless tobacco. But we didn't have products that were legal in the UK. Electronic cigarettes came along in around 2007-8 and have since become extremely popular in the UK. Our government has taken a very liberal line on marketing and use of electronic cigarettes. And so we're now in a situation where 2.8 million smokers have used electronic cigarettes, and about 1.2 million are regular ex-smokers who are using electronic cigarettes. And that has been achieved by arguing strongly the case in favour of a switch to a less harmful product for those smokers who can't quit. We've needed effective regulation to make sure the products deliver nicotine and that they're as safe as is reasonable to expect. But the key thing is to be able to promote those products to smokers. And the reason that I asked to give evidence today on the Canadian bill is simply the clause about making comparisons with the safety of smoking. Because I think it is absolutely vital that health professionals can say to smokers, we don't know the long-term risk of these products. It would be much better if you quit all smoking and nicotine use forever. But if you can't do that, then it is a no-brainer to switch to a less hazardous product. And I don't think there can be any question that electronic cigarettes are less hazardous than smoking. If we don't give that message strongly from the health lobby or the health opinion, smokers get confused and start to think that maybe these products are just as hazardous, so why bother to shift? And the default then is to continue smoking. And so that's my main issue, and that's, as I say, why I asked to give evidence today.